Did you know that persistent itching in certain areas of the body could be an early, subtle warning sign of cancer? While most people tend to dismiss occasional itchiness, especially as they age, it's important to recognize that not all itching is harmless. For individuals over 60, specific areas of persistent itch may be the body's way of signaling a deeper health issue. In this video, we'll explore 5 precise locations where itching could suggest the early presence of cancer, sometimes long before any other symptoms are noticeable. These aren't random spots. They're well-documented patterns identified by doctors in patients later diagnosed with conditions like lymphoma, pancreatic cancer, and breast or skin cancers. What makes this important is understanding not just where the itching happens, but why. We'll explain the underlying causes, how these symptoms relate to particular cancers, and how to distinguish between a temporary skin issue and a more serious concern. By watching this video, you'll gain practical knowledge about what to monitor in your own body, what to bring up during a doctor's visit, and how to act if these signs seem familiar. The goal here isn't to alarm you, but to help you become more aware. When it comes to cancer, early detection can make all the difference. Being attentive to these lesser-known symptoms could potentially lead to earlier diagnosis and more effective treatment. Let's get started. Sign number 1. Persistent itching on the lower legs. For many older adults, a persistent itch on the lower legs, especially around the shins and calves, might seem like a minor nuisance, perhaps chalked up to dry skin or aging. But when there's no rash, no visible irritation, and no new soaps, lotions, or detergents in use, this type of itch can be a quiet but significant warning sign. This particular symptom has been repeatedly noted in individuals later diagnosed with blood-related cancers, most notably lymphoma. This itch is not fleeting. It tends to linger and often becomes more intense at night. Unlike dryness or a skin allergy, it doesn't respond to moisturizers or topical treatments. That's because the cause isn't skin deep. It originates from within. Cancers like Hodgkin's lymphoma affect the lymphatic system, which plays a major role in the body's immune response and waste filtration. As lymphoma cells grow, they release inflammatory chemicals into the bloodstream. These chemicals can irritate nerve endings beneath the skin, particularly in the lower limbs, creating a persistent, sometimes burning sensation even when the skin appears normal. A striking real-life example is George, a 75-year-old man who spoke at a cancer awareness event. His only symptom for months was a relentless itch on the front of his legs. Initial guesses included eczema or a detergent allergy. But when standard treatments failed, his doctor ordered blood tests. Abnormal white blood cell counts and scans revealing swollen lymph nodes eventually confirmed lymphoma. George emphasized that the itching had been his only clue for half a year. Stories like George's are not isolated. While itchy legs alone don't necessarily mean cancer, the key factor is whether the itch is unexplained and unrelenting. If there's no visible cause, no rash, no insect bites, no changes in skin products, and the symptom persists for weeks, it's a good reason to seek medical advice. This is especially true if other symptoms accompany it, such as night sweats, fatigue, or unexplained weight loss. As we age, the body doesn't always announce illness loudly. Sometimes the signs are subtle, like an itch that won't go away. Pain and physical changes might not appear until much later. However, the nerves in our skin can respond to deeper internal issues before any obvious outward symptoms emerge. In these situations, awareness is key. If you or someone close to you is experiencing this type of ongoing discomfort, especially if it doesn't improve with typical treatments, it's important not to ignore it. Mention the symptom to a healthcare provider, ask for a blood test, and describe the full pattern. Often the body gives quiet signals well before a diagnosis becomes clear. Paying attention to these early signs could make all the difference in catching a serious condition early, when it's more treatable. Sign number 2, itching between the shoulder blades or upper back. There's a particular kind of persistent itch that occurs deep in the upper back, right between the shoulder blades, which many people tend to overlook or dismiss. Often it's blamed on poor posture, dry air, or even the tag on a shirt. However, for many older adults, a relentless itch in this exact spot, especially when it feels like it's beneath the skin, has been connected to pancreatic cancer. What's surprising is that this symptom can appear months before more obvious signs like pain or digestive issues show up. At first glance, it might seem strange that a problem with the pancreas, an organ deep inside the abdomen, could cause itching high on the back. But the explanation lies in the way pancreatic tumors affect the body. As these tumors grow, they can block the bile ducts, which are tiny channels that carry bile from the liver to the intestines. When bile flow is disrupted, bile salts build up in the bloodstream. These excess bile salts can irritate nerve endings, especially in areas dense with sensory nerves, like the upper back between the shoulder blades. I recall the story of Linda, a 70-year-old woman who described her symptom as a phantom itch on her upper back. She struggled with it nightly and found no relief from lotions, back scratchers, or even changing her mattress. The itch felt as if it was coming from inside her body. During a routine checkup for unrelated fatigue, blood tests revealed elevated liver enzymes. Subsequent scans discovered a small tumor in her pancreas pressing on the bile duct. Remarkably, that itch was her only noticeable symptom. No pain, no jaundice, just an unrelenting sensation she couldn't ignore. Because she spoke up about it, her cancer was detected early. This example highlights why it's important to pay attention to this specific area. While occasional back itchiness can result from dry skin, friction, or pressure, an intense localized itch that doesn't improve with topical treatments could signal something deeper. If accompanied by other symptoms like dark urine, pale stools, or fatigue, it's a strong indication that an internal issue may be at play. In such cases, the upper back becomes a messenger for problems originating in the digestive system. For older adults, subtle symptoms like these are easy to dismiss. It can feel like exaggerating to complain about an itch, but the body often sends quiet signals before serious problems become apparent. When the same symptom keeps returning, it's wise to listen closely. If you're still watching and finding this information helpful, please comment with number 2 to let me know you're here. And if you haven't subscribed yet, consider doing so and turning on notifications so you won't miss future videos. Your support enables us to keep creating content that informs and inspires. Now let's continue. Sign number 3, persistent itchy scalp without visible flakes or dandruff. An itchy scalp might seem minor, especially for older adults who often blame it on dry air, aging skin, or a shampoo that doesn't suit them. However, when the itching is ongoing and occurs without any visible signs like dandruff, redness, or flaking, it could indicate something more serious beneath the surface. In some cases, this type of itch can be an early warning sign of blood cancers such as leukemia or skin cancers developing on the scalp. What distinguishes this itch from ordinary dryness is the nature of the sensation. Instead of simple irritation, it often feels like tingling, crawling, or burning. The itch may shift from one spot to another and typically does not improve with regular treatments like anti-dandruff shampoos or moisturizing oils. For individuals over 60, these symptoms can be linked to nerve irritation caused by abnormal immune responses. This happens when leukemia cells multiply and disrupt the body's ability to control inflammation properly. A man named Henry, age 73, shared his experience with this symptom. He noticed his scalp itching every afternoon and initially suspected hair products or his hat. Even after changing shampoos and stopping the use of hats, the itching persisted. When Henry eventually underwent blood testing for unrelated fatigue, doctors discovered elevated white blood cell levels. Further testing, including a bone marrow biopsy, confirmed early-stage chronic lymphocytic leukemia. For Henry, the persistent scalp itch was the first and only early warning sign his body gave him. This is especially important because many older adults already face some degree of dry or sensitive skin, making it easy to dismiss such symptoms as normal. However, cancer-related itching is distinct because it resists all attempts at relief. No creams or treatments soothe the discomfort, which lingers and feels detached from any visible skin issue. In addition to leukemia, skin cancers on the scalp can start as small itchy patches, often mistaken for dry skin or minor bumps. If an area on the scalp continues to itch in the same spot and does not improve, it should be examined carefully by a dermatologist under proper lighting. Since the scalp can be difficult to inspect on your own, it's helpful to have a spouse, caregiver, or hairdresser check it regularly. If you notice an itch that lasts for weeks and refuses to go away despite treatment, it's time to investigate further. This is especially crucial if you're also experiencing other symptoms like unusual fatigue, easy bruising, or a general feeling of being unwell. What may seem like a small or insignificant itch could actually be an important early sign, signaling a deeper health issue that requires attention. Sometimes these persistent, stubborn symptoms reveal the biggest stories about our health. Sign number 4, localized itching on the chest or breast area. When older adults, especially women, but men as well, experience persistent itching around the chest or breast area, particularly near the nipple or just beneath the breast, it's often easy to dismiss it as something minor. Common explanations include sweat, tight clothing, or age-related thinning of the skin. However, this specific area is one of the most frequently overlooked spots where itching might be a sign of something much more serious, such as inflammatory breast cancer or other tumors growing near the chest wall. What makes this symptom particularly important is that it can appear long before any lump is detectable. The skin in the affected area might feel warm, irritated, or tight. Sometimes there's a noticeable change in texture. It could become rougher, thicker, or slightly reddish. But just as often, there might be no visible changes at all. Instead, the person experiences a deep, persistent itch that refuses to go away, regardless of how many creams or lotions are applied. I remember a woman named Ruth, who was 69 years old, who shared her experience with this symptom. She noticed an unusual itch around her right breast and initially thought it was due to friction from her bra or a reaction to laundry detergents. She even tried going without a bra for a while, but the itch stayed exactly in the same spot every day. When she finally visited her doctor, a slight dimpling of the skin was observed, prompting further testing. The test revealed a small yet aggressive tumor growing near the skin's surface without the typical round lump many expect. This is part of why inflammatory breast cancer is so dangerous. It doesn't follow usual patterns, often mimicking a skin rash and spreading quickly. Pain is often absent early on. Instead, irritation is the first sign. That's why paying close attention to an itch that remains localized, does not improve with moisturizers, and occurs in the same place repeatedly is crucial, especially around the breast or chest. For men, this symptom can be even more easily overlooked. Male breast cancer is rare but does occur, and it often goes undiagnosed because its signs don't fit common expectations. An itchy patch near the nipple, a small area of thickened skin, or persistent discomfort under the chest muscle might seem insignificant, but for men in their 60s, 70s, or 80s, these should not be ignored. Additionally, this kind of itch is not always caused by cancer in the breast itself. It can also be a result of swollen lymph nodes under the arms or just below the collarbone, which might indicate lymphoma or another nearby cancer. If the itch is accompanied by swelling, warmth, or a vague feeling of heaviness in the area, don't delay seeking medical advice. Early detection doesn't begin with expensive tests or machines. It starts with awareness and paying attention to subtle, unusual signals. Your skin may not speak, but it sends important messages, and this type of persistent itching is one you definitely shouldn't ignore. If you're still watching and finding this information helpful, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on notifications so you don't miss future videos. Your support helps us keep making valuable content to inform and inspire you. Now let's continue. Sign number 5, persistent itching in the anal or genital area. Itching in the anal or genital regions is often uncomfortable and frequently overlooked, especially among older adults. Many find it an embarrassing topic and prefer to ignore the symptom rather than discuss it. However, when itching in these sensitive areas persists without any obvious cause, such as poor hygiene, infections, or irritation, it may be signaling something far more serious. In certain cases, ongoing itchiness here can be an early subtle indication of cancers like anal, vulvar, or penile cancer. What makes this type of itch particularly concerning is how easily it disguises itself as a minor issue. People often attribute the sensation to dry skin, irritation from toilet paper, friction caused by walking, or the use of incontinence pads. And indeed, many times these factors are to blame. But if the itching lingers for weeks or even months, returns despite regular cleaning, treatment, or moisturizing, and begins to feel raw or burning rather than just surface-level irritation, it's important to have it examined more thoroughly. Take the example of Eugene, a 76-year-old man who suffered from what he thought was hemorrhoid-related discomfort for nearly a year. He tried various remedies, creams, dietary changes, cold compresses, but the itching never fully resolved. When he finally consulted a colorectal specialist who performed a scope exam, a small lesion was discovered on the anal canal wall. This lesion was an early-stage tumor that would have silently grown worse had Eugene ignored his instincts that something was wrong. Women also face similar risks. While vulvar cancer is relatively rare, its incidence increases after age 60. One of its earliest signs is persistent itching around the outer genital area. There may be no noticeable lump, but the skin might start to feel rougher, change color slightly, or become thinner. Many postmenopausal women assume this discomfort is simply due to hormonal changes or dryness, which is sometimes the case. But if the itch is relentless, worsens at night, and does not improve with typical treatments, it should not be dismissed. This area of the body is densely packed with nerve endings and is very sensitive, making it one of the first places where internal changes become noticeable before other visible symptoms appear. Whether caused by changes in skin cells, nerve inflammation, or swollen lymph nodes nearby, chronic itching localized to one side or focused on a small spot could be an important warning sign. Despite these facts, many people hesitate to mention such symptoms, fearing embarrassment or worrying they might be overreacting. However, staying silent is much riskier than speaking up. Sharing your concerns about persistent itching could lead to early detection of a serious condition, resulting in better treatment outcomes and peace of mind. The key message is simple. If itching in the anal or genital region doesn't go away, don't assume it's normal. Seek medical advice and have a healthcare professional examine the area. Early detection of serious issues like cancer often begins with recognizing small, subtle changes, and choosing not to ignore them can make all the difference. Final thoughts. As we wrap up, remember this simple truth. Your body is always sending messages. Sometimes those messages come as pain or fatigue, but often they begin with something subtle, like an itch that keeps returning to the same spot. The 5 areas we discussed today, the lower legs, upper back, scalp, chest, and genital region, are not random. These are places where early signs of serious conditions, including cancer, may quietly appear. For older adults especially, recognizing and responding to these early signals can make a critical difference in catching something early. This isn't about living in fear, it's about awareness and trusting your instincts. A small, persistent symptom may be your body's way of asking for attention. If any of these signs feel familiar, don't ignore them. Talk to your doctor, ask questions. You deserve clarity, care, and peace of mind. And it all starts by listening to your body. Thank you for watching today's video. We'd love to hear your thoughts. Leave a comment below with one thing you learned and how it might impact your life. Your feedback means a lot and keeps us inspired to keep going. If you found this video helpful, don't forget to like, subscribe, and share it with others. Your support allows us to continue creating valuable content that educates and empowers. We truly appreciate you being here, and we look forward to connecting with you again in our next video.